Okay, let's unpack this. Today, we're diving into a really crucial topic, one that's often misunderstood: alcohol and other drug-facilitated sexual violence, or AOD-facilitated sexual
Yeah.
violence.
Mm,
Our mission in this deep dive is basically to pull out the most important insights from a recent global scooping review. It's by Eisen and colleagues from 2024.
right.
We want to cut through some of the noise, get to what's actually known about this complex public health issue, give you the clearest understanding we can.
Absolutely. And, to really get into it, we have to start with the definition itself. How is AOD-facilitated sexual violence actually defined? Because that's where some key misunderstandings lie.
Okay.
What's often missed is that it's not just about someone being drugged without their knowledge, like, the classic date rape drug
What
idea.
a spiking narrative.
Exactly.
Uh,
It also explicitly covers situations where a perpetrator takes advantage of someone who has voluntarily consumed alcohol or drugs. The point is, their ability to consent is compromised.
Okay. So the focus isn't just on the substance, but on the perpetrator's actions.
Precisely. Legally, ethically, the focus is squarely on what the perpetrator did, regardless of the victim's choices leading up to that moment.
That feels like a really important reframing right from the start. And it definitely pushes back against that common story we hear, the drink spiking by a stranger in a bar scenario.
It does.
What does the research actually tell us about that perception? Because I suspect it's not the whole story.
You're right. It's far from the whole story. The Allison review makes it really clear how much that popular idea misses. Like, for instance, people often think of, specific illicit drugs.
Yeah.
But the research consistently points to alcohol as the most common substance involved. One big study found it in something like 79% of incidents.
79%. Wow.
Yeah, huge. And contrary to the whole stranger danger myth, perpetrators are overwhelmingly male, yes, but they're almost always known to the victim.
Known to them, not just random people.
Exactly. Friends, acquaintances, partners, ex-partners, not usually anonymous figures. And even the where is surprising. Private homes, houses, apartments are reported more often than places like bars or clubs.
Okay, that completely shifts the picture. It's happening in familiar places, often with familiar people.
It does. It forces us to look beyond just external threats and consider these, well, more complex and often intimate dynamics.
So if this is the reality, what does it mean for the victim survivors? How does this kind of violence, especially with substances involved, impact them specifically?
Well, the impacts are incredibly severe, really multifaceted. We're talking significant mental health issues, PTSD, depression, even suicidal thoughts.
That's devastating.
It is. And a really troubling detail is how common amnesia is. Research found that about 40% of victims couldn't recall the actual assault because they were incapacitated. Imagine that extra layer of trauma, the difficulty in processing.
Yeah, that must make seeking help incredibly difficult too.
It really does. And while some victims do seek support, the evidence is kind of mixed on how often people report to the police, for example.
Mm-hmm.
There's often deep shame, self-blame, and this real fear of not being believed.
Which I guess ties into those societal attitudes you mentioned.
Exactly. It all connects.
So let's go there. This portrayal in society, the attitudes around AOD-facilitated sexual violence. How do those narratives, especially when someone chose to drink or use drugs, end up blaming the victim?
It's a really harmful cycle. The media, for instance, often frames these incidents as sort of cautionary tales. The focus lands heavily on the victim's behavior, what they drank, where they went.
Right, instead of the person who committed the assault.
Precisely, instead of the perpetrator's criminal actions.
Okay.
And this directly fuels victim blaming, especially if the victim voluntarily consumed something. There are these mock jury studies researchers do.
Simulations.
Yeah, to see how juries might react. And they consistently show that victims who voluntarily used alcohol or drugs, they're seen as less credible. It just reinforces these awful, entrenched rape myths.
Those false beliefs that shift blame.
Exactly, shifting accountability away from the perpetrator where it belongs.
Okay, so there's a huge gap here between the reality shown by research and how it's often perceived or talked about. What does this mean for actually moving forward? What can we, do?
Well, the review points to some clear needs. First, we really need consistent definitions,
Yeah.
like across the board in research and policy. And we need more diverse research looking beyond just, say, college students.
Get a broader picture.
Right. Different ages, backgrounds, cultures. a truly global view. But crucially, the focus needs to shift.
Right.
We need to understand perpetrator motivations, their methods, the role of harmful drinking cultures that might enable this.
Rather than just focusing on what the victim did or didn't do.
Exactly. Stop scrutinizing victim behavior. The aim has to be challenging those victim-blaming narratives head-on and building effective interventions that put accountability squarely on the perpetrator.
This whole conversation really makes you think, doesn't it? How easily these stories, these narratives can shape understanding and shift blame. It shows why digging into the actual evidence is so vital for public health issues like this. What really stands out to you about just how easily that blame can get shifted? And maybe what's one small thing you could do or encourage others to do to challenge that in everyday conversations?